Gentlelady from Hartford.
Thank you, Madam Speaker. Could the floor leader rise for a few quick questions?
Floor leader.
Absolutely. Hi, how are you?
Good to still see you here. I know we'll lose you soon. Okay, so I'm just looking through this, and I see you have made some good changes. There's now community input meetings. I see that's awesome. Could you just tell me a little bit about what the real goal is? There's a lot of dense wording here about what sort of explain the impact of foundational public health capabilities.
I know, it's confusing, I know, when you read it.
Yeah.
So let me explain to you. Foundational health capabilities include the ability to do assessment and surveillance, community partnership and development, equity, organizational competency, public development and support, accountability, performance management, emergency preparedness and response, and communication. So how does our public health system do its work? Does it have the capacity it needs to do its work? That's what this bill is going to find out. We're going to do an assessment and then make recommendations through a commission.
Okay.
It's just a commission with a report.
Okay, yeah, that helps a lot, actually. So when I first looked at it, thinking that it was kind of a post-mortem on how we did as a state, because I know many of us in this room know that we had a lot of abject failures through COVID. We made a lot of policies that were completely ineffective. I have here the latest Cochrane review. It's a meta-analysis. It's the gold standard of peer-reviewed research that shows all of our masking policies were utterly worthless. So I'm just wondering if we're going to be touching on the failure of masking, of the failure of our mass vaccination plan. It did not work. We were told that the buck stops with us. As soon as I get my vaccine, I can't spread it anymore. That turned out to be an utter lie. So are we going to be doing a real post-mortem assessing not just structurally how to respond, but whether or not our policies were a total failure?
So this commission is going to be looking at the capabilities of our public health infrastructure and then making recommendations on what needs to be improved. So it's really, I can read you specifically the language that is in the bill, right? So they're going to be making an assessment. They're going to explain the impact of those capabilities I just told you about, to the need for those capabilities in addressing public health. And we're not talking about just COVID, to be clear. In the recommendations, we're talking about maternal mortality, we're talking about opioid issues, and the opioid crisis. So we want recommendations that will help us figure out how to your point that you started with, right, which is, I would prefer to frame it as, we're all here, this is great, we could have done better.
Right.
We could have done better.
Right.
And we need to acknowledge that. So in ways that our public health system needs the support to do better, that's what this is going to look at. Do we have the capabilities we need? If not, what are the recommendations to ensure that for the next crisis, we do better?
Okay, so it won't be looking at specific policy and science-based decisions, more just the structural issues that we had rolling out the programs that ended up being failures.
Well, I would disagree on the failure part, but I would agree with your assessment on what the commission is going to be doing and making recommendations on. Specifically, we're going to be making recommendations on how state and local public health departments are organized on information technology, information exchange, data and analytics, workforce issues, including human resources, and the use of the Medical Reserve Corps for public health, procurement issues, including oversight of contractors, funding, communications, and public engagement. So things like that.
All right, I thank the floor leader.
Thank you.
Body, I certainly don't oppose the idea of doing an analysis on the structure of our public health. I think that's actually really important for us. I would have loved to have seen us be really thoughtful and considerate to the insane suffering that the policies made by this body and others, even at the top, hurt our communities terribly. Locking children out of their schools, keeping them away from food and safety was a total failure, and it hurt the most vulnerable children that we like to grandstand and say that we're taking care of every day on this floor. We hurt them terribly, and I would love to see our body acknowledge what we did to these people. Thank you very much.
Recognizing the floor leader.
Thank you, Madam Speaker, and thank you for your thoughts on this. I would just like to remind the body, first of all, this bill passed the Health and Government Operations Committee unanimously, and I would also just say on HGO we have a term called philosophical differences. And I think you just heard about some of the philosophical differences around the issues of COVID that we have experienced, but that's not what this bill is about. This bill is about making sure that we have the public health system we need for the future to serve our constituents in all of the issues that are important to us and protecting the public health. Thank you.